Good morning, everybody. Welcome to Solidarity Live. It's sort of a sad morning this week as we have lost not one but two innocent Black men, well, one man and one child, to police murder this week. So that's an unfortunate way to spend this Friday, but we're holding space for their families and for George Floyd as that trial continues. Alex, good morning.
Fortunately, as the pandemic is we're starting to turn a corner with the mass vaccination program, but unfortunately, a return to normal here looks like a return to police violence, shooting unarmed people, and also like mass shootings. So it's sad, but I do think that we know what we need to do. We need to take on an unaccountable system and change it. And we're going to be talking about a bunch of things today. But one of the systems that is totally unaccountable that we are going to talk about today is the healthcare system, which is not actually a healthcare system in this country. It's a wealth extraction system set up by these plutocrats on Wall Street to just extract wealth from people by holding their health hostage through denying care. These insurers, big hospital, just squeezing for every penny possible and blocking any transformative change to a system where healthcare is a right. And these pharmaceutical corporations who literally withhold access to drugs to drive up the price, and that leads to people dying. And that's their business model. We've talked about it before. We're seeing it. We see it in the drug price space, but also now with vaccines, where we are in the midst of a vaccine apartheid situation, where you do have rich countries like the United States of America doing pretty well with mass vaccination programs, but the rest of the world is just left with no access to vaccines at all. And that system is immoral. That system is violent, and it needs to be destroyed. And we need to actually build a system where justice and public health are the guiding lights of the system. And I'm really happy to be joined today by Melinda St. who is the campaign director for the Medicare For All campaign at Public Citizen, to talk about why now is the moment where, even though we might not win everything, we have to win as much as possible right now in order to shorten that path to a changed system based on justice. So Melinda, thank you so much for joining us here on Solidarity Live.
Thrilled to be with you. Thanks so much.
So you heard my intro, and I feel like most of our audience understand why now, but why don't you just give us a 101 on what's happening, what are the opportunities now to take on this immoral system that is holding people's lives hostage for profit?
Well, yes, thanks so much. I think you're right. This is an exciting moment in a lot of ways. It's also a very sobering moment. We have more than 500,000 lives lost due to COVID. We have a broken healthcare system with people who are struggling, millions of people who have lost their health insurance along with their jobs. And we know that the system cannot continue as it has, and we have to mobilize for change. We have some really great opportunities right now, and I think maybe even more than we thought we were going to have. We are excited that the Biden administration and the congressional leadership are moving forward to have a broad infrastructure plan that is being discussed right now. President Biden mentioned the American Jobs Plan first, and then a second package that will be unveiled soon called the American Families Plan. And the American Families Plan will include infrastructure for our families, and there's a lot that could be potentially included in there. And there's been a lot of organizing over many years that has pushed the Democratic Party and the Biden administration much further in a much more progressive direction than we have seen in recent history. So there is a commitment by the administration to improve our public insurance system and Medicare, to improve Medicare for seniors, to expand what is covered under Medicare, and to include an out-of-pocket cap so that people are not potentially on the hook for thousands of dollars or hundreds of thousands of dollars down the road, and to lower the eligibility age for Medicare, in addition to really challenging the drug companies, and to negotiate prices, to bring prices down, and to challenge that monopoly model that you've talked about that's really a wealth extractive model. So there's a real opportunity now to make some incredible gains forward toward universal health care for everyone.
So let me actually follow up just quickly, Jocelyn, just to break it down slightly. What we're looking at is one package that includes what we talked about last Congress. We fought over a thing, we shorthanded HR 3. But what that is Medicare negotiation. We allow Medicare to negotiate drug prices down. And that saves money for people, but also for the federal government, because the federal government is the largest buyer of prescription drugs in the world, the U.S. federal government. And so the savings from that, what you're saying is we pump that back into Medicare in order to add benefits and changes that equalize Medicare to private insurance, and then expand who gets Medicare. And in our parlance at Social Security Works, we call that shortening the path to Medicare for All. As long as the policies that we are pushing and trying to get, the gains that we're getting would get us to single payer Medicare for All, we will support that. And what we have to fight against are anything that's going to lead us down a garden path away from Medicare for All into more corporate private insurance. So just briefly, I'm very hopeful, and mainly it's because I feel like we're going to work really hard, Melinda, as we have for years, but we're going to never stop fighting for what we want, which is Medicare for All. But what are the headwinds? Because we are facing some headwinds. There are some different ideas, and basically the different ideas are a variety of ways of putting the savings from Medicare into private insurance instead of into public programs.
Right. I think that what is exciting is that we are going to achieve hundreds of billions of dollars in savings from negotiating drug prices. And the question is, how do we know currently 1/3 of our healthcare dollars goes to profit and bureaucracy and not to care. And so we know that if we suck some of the profit out, then we can invest that back into care. And the most efficient way to do that is to pump it into the very efficient Medicare system. There are headwinds, as you mentioned. The private health insurance companies, they want to capture as much of that as possible. And so, there are proposals out there to subsidize, which would be helpful to families for sure, to subsidize people's private insurance premiums. So we could do that, but that would be far more expensive because, again, we're funneling that money back into more profit making, and we would be able to cover far fewer people if we go that route. If we say we're going to take some of the profit out, but then we're going to put it back into more profit to other private insurance companies, we don't get the real care that we need for the millions and millions of people who need it.
Well, Melinda, so I know that we're in a really great space. As you're saying, there's a lot of hope with the things that the administration is talking about and trying to get money for. What do you think the chances are of us having Medicare for all? Like, what does that fight look like?
Well, that fight is about, I mean, we have been winning that argument over the past several years, which I think is really exciting. What we need to do is build up the people power and the base that is powerful enough to challenge the corporate interests that are going to fight us every step of the way. I mean, that's we're just fight. That's the fight up against us, right? We know that we have all the moral argument on our side. We know it is extremely a popular policy. Even a Fox News exit poll and after the 2020 election found that 70% of Americans said that voters said that they would support a government-run healthcare system because people are fed up. The greed in this system is just too much. It's too much in red states. It's too much in blue states. This is a popular policy, but the corporate interests are spending millions and millions to preserve the status quo and to fight every step of the way. And they're spreading lies. They're spreading lies that are confusing people about choice, about what the possibilities are, when the reality is we know that Medicare for All would be free care at the point of service for everyone living in the United States for comprehensive medical care that we need, and that it would save money overall, trillions of dollars over 10 years, and it would save money for families because we are currently paying this extremely regressive tax in terms of our healthcare premiums, those of us who are lucky enough to have employer-based insurance. And what we need is a system that actually taxes people according to their ability to pay and then provides everybody with comprehensive health care. So we need to build the movement, and we are building the movement. I mean, the fact that we introduced the Medicare for All Act of 2021 last month with more than half of the Democratic caucus supporting it. And with 15 key committee chairpersons that are also co-sponsoring this bill. This is a mainstream policy now, and we need to continue to build that movement that is powerful enough to beat back the lies that are being spread by the corporate interests that want to maintain the status quo.
So you're saying that what we should do is just build a system where if you get sick, you get the care that you need. And it doesn't bankrupt you or your family. And we pay for it with a progressive tax system. And everybody wins except for a handful of billionaires who actually, because they're billionaires, they'll probably win too. So it's literally just a matter of political will. And what political will is a shorthand for is basically, they're either, we do have champions. We have good members of Congress who are fighting for things. But the mushy middle, we need them to actually be scared of the popular movement pushing for Medicare for All more than they're scared of the just fire hose of money that these three incredibly profitable industries, big insurance, big hospital, and big pharma, can fire hose at them for taking on their corrupt system. And I feel like one of the things that is sometimes misunderstood in this fight is the idea that the fight is actually located in the Congress, right? That politicians are going to be the leaders on this. And I always say people have to understand that politicians are a lagging indicator. They don't go first. They follow where we lead. And all of the effort has to be in popular movement building. And the best way to build that is to actually show people what it is that we mean in what we would do with improved Medicare for All. First, we improve the benefits. And that's what we were talking about doing with adding an out-of-pocket cap, adding vision, hearing, dental. we improve the benefits, and then we expand it to everybody. So we want to first go down to 50 because that is where a lot of key medical decisions start. That's where you start having a bunch of screenings and other things where that, what would be the point of telling somebody who doesn't have comprehensive coverage, like go get a cancer screening, but if it's positive, there's not really much you're going to be able to do until you turn 65, right? And you just cross your fingers. That's the immoral system we have right now. We want to lower that age to 0, and that's the goal. But the millions more that we push in, and the political reality is Joe Biden has said to 60, from 65 to 60. Bernie Sanders has said 55. We say 50. The magnitude of this, of even 65 to 60, though, we're talking millions of people more into the public system that works, and traditional Medicare, the public system, and that just strengthens our hand when it comes to expanding it further. For example, I know we've talked, and it's on our agenda, but I don't think this go round. We also could cover all children with Medikids. So then we add 0 to 18, or like the ACA did, to 26. You bring it down to 50, and then you've only got, the middle part is where the corporate insurers are. And that is easy to just squeeze them down until it's actually just one system that is not based on profit, but that is based on that doctors and care providers are driving instead of bureaucratic middlemen. You've been doing this for a long time. You and I have been doing this together for a long time in this fight. Sometimes it's hard because you feel like, oh, this is incremental, or we've heard this before. Are we ever going to get there? But like, I try to tell people, I'm like, I have done this for a long time, and we are doing better now. Yes. Than we ever have, and we need to increase. We need to go as big as possible right now. That is the best thing that we can do. And again, it's going to be a fight. It's always going to be a fight because there's no profit on our side, right? Like we don't have bank accounts with 8, 9 zeros in them to just defend big people. Like we're on the side of big people. So we're going to be up against these soulless sociopaths and the ad firms that they hire, but we're going to win because we tell the truth, and because it's so obvious. You get sick, you get the care that you need. That's it. So I want to just spend a little bit of time on that. Like, we're doing really well, and the solidarity that it takes, where we stand together, workers, students, nurses, doctors, small business owners. We've seen so many people coming in and forming this movement. Just talk a little bit about your feeling on that. If you think I'm being too hippie-ish, rose-colored glasses on where we are right now.
No, I think you're absolutely right. I mean, we don't have the rose-colored glasses so much that we don't know the challenges that we're up against, and and the adversaries are so extremely powerful. But the fact, I mean, I don't think we can. We need to emphasize how far we have come. The fact that there is an American Families Plan that is really contemplating improvements to our public insurance system, that is really contemplating lowering the eligibility age for Medicare. That was unthinkable even during the Obama years. That was not something that was even contemplated or on the table. And that is because we have built a lot of power. This is the insurance companies are scared of this. They cannot believe that we've gotten to this point. I believe that very strongly. They are running scared. They are going to, we looked a couple of years ago at how much insurance companies were spending on lobbying and the number of lobbyists. And they had increased 9-fold the number of lobbyists lobbying on Medicare for All in 1 year. And that was because they suddenly were taking us seriously. They realize this is a serious threat to us. And that is because we have organized and because of the coalition that we have built that you mentioned. We have, for the first time over the several years, we are seeing more and more business owners coming together and looking at their bottom line and saying, what the heck are we doing here? I became an entrepreneur because I wanted to invest. I wanted to create a product. I wanted to provide a service. And what I am actually doing is becoming an insurance broker for my employees. It's not my expertise. It goes up year after year. The 20% increases in healthcare costs. I'm not able to provide raises. I have to lay people off. This is not doable. And then the pandemic hits, and now it's just like game over for many of these business owners. They need to take, they can no longer be the healthcare providers in our country. And it doesn't make any sense. And it makes us less competitive compared to other countries, companies in other countries that don't have to do this. And so that group has come on board. We're seeing, labor unions who have spent, so much of their capital, their capital in negotiating with having to try to stop them taking away healthcare, premiums or taking away healthcare, and so they aren't getting increased wages. They're not able to take more from, more of the profit from their employers. And so again, it's in some ways, it's the greed of the system that has helped us organize, because now even the middle class, even those of us who are supposedly doing great, find ourselves one health crisis away from bankruptcy, losing our homes, even if we have insurance. We see that when you have to use your insurance, that's when the whole business model kicks in, where their business model is to take in more in premiums than they pay out in care. So all their incentives is to deny care, to deny it. And so doctors are coming on board because they're saying, I'm spending all of my time fighting with insurance companies to get the care for my patients that I need. Nurses are obviously at the forefront of this fight too, because they're seeing every day. And the COVID-19 pandemic has just like blown all of that just out of the water and made it so clear that, that we need a real public insurance system that provides people the care when we need it, provides preventative care so it's not more expensive down the road when people have to go to the emergency room because they haven't gotten preventative care. And that, all of those realities are coming together, and we're using that. We're organizing at the very local level. And we are actually making a huge change. And, we're pushing even the most conservative wings of leadership are having to recognize that they have to invest in our public insurance system.
I love that you bring that part up, Melinda, because it's not, the preventative aspect is something that I think goes unrecognized by a lot of people. Americans pay more in healthcare and go to the doctor less than anyone in the developed world, right? And which makes sense. I mean, it's very difficult to incentivize yourself to go to the doctor even when it's free. It's not like a blast. And if you're going to have to pay $400 for something that, why would you do it? There's this very real feeling of it's expensive, it's stressful, it's also complicated, which is something that, I love that you're touching on that with the small business serving as a broker between insurance companies and patients. It's like, this has all become so wildly complicated that most people don't even have a solid sense of what is covered and what isn't covered. This isn't an intuitive system in any way. And people, if you're getting a serious diagnosis, or even if you're just going for a primary checkup, your number one concern shouldn't be, how do I pay for this? What is covered, what isn't? That's a level of stress that we shouldn't have around our personal health at a time when medical advancement is taking such leaps and bounds. We should all be excited about healthcare right now. This vaccine that's available to us is kind of this amazing testament to modern medicine. They were able to come up with a vaccine in a relatively short amount of time. We should all be so excited about medicine and everything that's happening. Instead, it's being exploited for profit, and people are still dying. People are dying as much, if not more than ever before. That Harvard study that found 45,000 people a year die because we don't have single payer. And that doesn't count like the bankruptcies or the being stressed out or missing diseases. No, just like dead. That's just so unacceptable.
Yeah. Well, right. I mean, and this whole idea around choice, like wanting to have choice around your private insurer, who has choice? Like I have probably, I am fortunate. I work for Public Citizen. We work on this issue. So we have the best private and health insurance money can buy. Thank you to my employer for doing that. And we pay dearly for it. And I'm sure we would have higher wages if we didn't have to do that. However, I'm really grateful for it. But yet I have to deal with in-network, out-of-network all the time. I've tried to figure out which doctor is covered, which hospital is covered, what mental health care providers are covered all the time. And that's the best our system provides, the absolute best. Imagine, what is choice? Choice is being able to go to the doctor or hospital of your choice because there is no network. Everybody is covered. That is what would happen under Medicare for All. So, I mean, in terms of like the complexity, it would just simplify things so much for the providers, for the patients. And it would mean, I think it's been quite telling. The COVID vaccine is very exciting because we have, for the first time that in my memory, a health service that is being provided free at the point of service to everybody in the United States who wants it. However, I think it's been really hard to convince people that that's the case. I think people aren't even primed to believe that they could go and get a shot and not have to pay for it. And so we have to overcome that hesitancy that people have, and the same thing with COVID tests and with treatment. Congress had to pass a law to try to and piece together and kind of force private insurers to say that they were going to make the COVID tests and the treatment free. And then, of course, we find more and more cases where people are getting bills for thousands of dollars for their COVID tests and their treatment. And then they have to fight it. And, that's what happens in our system. Instead of having something that everybody can trust and to have full choice over their healthcare, which is absolutely not what exists now.
Yeah, it's hard. We talk about this on this show a lot, that there's massive propaganda cannons aimed at the American people all the time, and they really warp the way we see things. And a lot of it is actually spent on being like, it's your fault, it's on you, it's your responsibility, right? It really feels that way, and so it's like, don't be a freeloader. All of that messaging is there, and it creates a huge shame complex around health. That is, I worked in outreach clinics and HIV clinics before moving to DC to get my master's to dismantle this corrupt and immoral system because of what I saw in clinics. And I don't think people can fully understand the harm, both the physical harm that leads to, because when people see getting sick as a personal failing, wouldn't have gotten MS if it wasn't for, right? Like all of that, it leads to us as individuals blaming ourselves for the structural violence that we are faced with. And if we could click in people's brains, like, it's being done to you. It's not your fault. It's being done to you. It's being perpetrated on you. Then the rage that people would feel. Anybody who has touched the medical system at all would just be infuriated that this is BS. That was for you, Brad. I didn't swear, but I really wanted to. That in every other peer nation too, every other they have figured out a way, because it's not rocket science, it's not that complicated, to build a system where if you get sick, you get the care that you need.
Well, and the problem, I mean,
go ahead, Jocelyn.
problem is that I think a lot of people have internalized that shame and they've also offloaded it on others. You know, one of my least favorite family members, we have this debate all the time, and they'll say lots of exciting things like, well, fat people need more medical care. So do my taxes have to go to people who are overweight or who've smoked? And like, you will hear that from people, like this totally misguided idea, one, of how physical health works. Like, there isn't actually a lot of research that supports the idea that being overweight is like this drastically unhealthy thing. And two, I actually don't care if someone has smoked. If they get cancer, they should get the care they need, and they shouldn't have to pay hundreds of thousands of dollars to do it. And regardless, your taxes are not going to go up. All we have to do is tax Jeff Bezos.
Well, I mean, and of course, I think on a lot of progressive policies, we need to make that argument that people should care about people other than themselves. On healthcare, actually, we don't even need to do that. We actually are going to save money. Like, you're going to be paying less. Like, even if you do end up covering the smoker who you don't care about, you're still going to be paying less than you are now. The current premiums for a family plan, the average is $21,000 a year. That is not counting deductibles. It's not counting all the out-of-pocket costs that people have. And the thing is people are dumb about this. They don't see it necessarily, because if their employer's paying all the premium or paying a portion of the premium, they're paying, less, but you are earning less wages because of this. $21,000 of your compensation package, if you're lucky enough to be employed right now and have insurance, is going to line the pockets of private insurers and big pharma instead of going toward your own care and the care of everyone in this country. I mean, that's the thing. We can cover everyone. This idea, when they say, how can you afford it? It's just preposterous. What we cannot afford is what we're doing now. We cannot afford to be spending $3.6 trillion a year when a third of that money is going to line the pockets of big corporations and going into waste, fraud, and abuse. That's what's happening now. Medicare has a 2% overhead, whereas private insurance has at least 14% overhead. Medicare provides healthcare to people over 65, the part of our population that consumes the most healthcare, and they are far, far more efficient. That is because it is a program that does not focus on trying to extract profit at every stage of the process. And so we can look to other countries about how to do this, which would make a whole lot of sense. But we can also look at our own country and look at Medicare and figure, we know how we can improve it. We know that it is, and then we can expand it. So this is something that I get frustrated having to explain it to people over and over again, because it's just so obvious. And yet, because of the lies, because of the propaganda that Alex was talking about, people are confused, and they continue to be confused by this dishonest, very dishonest propaganda campaign that confuses people. Because obviously, we're talking about your health. Change is scary, but I think change is becoming way less scary as everyone's realizing that what we have now is not working. And the COVID pandemic just made that so clear.
I think that's a really important point. We were talking with Mike Elk, I think 2 weeks ago, about the union organizing in Bessemer, Alabama, at Amazon, which failed. We were talking before the vote came in. And actually we talked about after the vote last week, I think. It is something that I think advocates, I'm agreeing fully with what you just said. And also, I'll just throw in there a joke that I often tell, as I do this, I fight for this every day. But my gradient used to be, or differential, I was 100% justice. But then as I had to deal with the system more and more, the medical system, I'm in it also for myself. And I'm getting close to 50-50 I just want to not have to deal with the BS that I have to deal with. When you have kids in this country, basically what that means is you will just get from the moment of birth right now, just random bills forever. And you're like, what is this for? And they're like, I'm sorry, we can't tell you. And they're like, we don't know. And you're like, how are you able to just charge me $5 forever? And they're like, oh, well, we do it on a net 154-day process. So this is something. Did you have something that you saw, doctor, last year in the middle of the year? And you're like, what bananas system is this? And it infuriates me. And then as at Social Security works, we have employees we provide healthcare for. So we also do the thing that you were talking about, and it's maddening. And it's Obamacare, it's the marketplace. And, like somebody's name changes because they get married and they're like, oh, actually, this process is going to take 2.5 years and you'll probably lose some medical coverage throughout it. And you're like, what? Right? I mean, it's crazy what we have to deal with. And that's what I mean. Like if we could get people to understand that that's being perpetrated on us, then we could get the anger directed in the right direction, right? That these companies are doing this to us, that the bosses are culpable. And you brought up this fear of change. And I often think that we don't spend enough time as, activists understanding that and speaking to it, that people are right to be afraid, right? Like workers who are being brought into a room by their bosses and being told, if you agitate to form a union, we're going to fire you, right? And if you narc out people who we'll give you a promotion. Like that's right in your face, the sociopathy that you're up against, right? Like this is your life. This isn't an issue. And it's the same thing with health, but even maybe more, because sometimes it's like your life is on the line. Your child's life is on the line. And so people are scared. They're grasping to the small bits that we're allowed to have and saying, please don't take that away from me. But very bleakly, what you're saying, and I agree with, is the system has entered a terminal phase. It's a terminal velocity where the greedy Wall Street hedge fund and private equity, they can't stop. And so people don't have crumbs anymore. And then COVID, they're just like, oh, yeah, do you see now how stupid it is to have health connected to your employment? You lose your job because of a pandemic. You lose your insurance, right? And then people will start to hear us more about, like, do you get how silly it is? And by silly, I mean rage-filled, that you lose your job because you get sick. You get too sick to work, and then you lose your job, and that means you lose your insurance that you need because you're sick. That's the system that we have right now. What a con they've been able to pull on us. So I feel like, and I could be wrong, maybe it's love will conquer all, but in this case, I feel like the antidote is, it's definitely solidarity, but it's also directing the anger at the perpetrators, who are big hospital, big insurance, and big pharma, and understanding that they're doing this to us. And politicians who aren't fighting them, they're fighting us. If they're not on our side, they're on their side. And no excuses. Get on our side, because we're not going to stop until we fundamentally transform this system. That wasn't really a question. Yeah. That was just me stumping Melinda.
No, but I mean, absolutely. And I think that some politicians, even those who didn't sign on to the bill under the Trump administration, are now signing on to this bill. And I think because COVID has just broken open, there's just like no excuse anymore. And I think, and it's really powerful that we have been able to build that movement. And I just want to give a couple of examples of how since the pandemic, one of the tactics we've been using in terms of building enduring local coalitions is passing local municipal resolutions in support of Medicare for All. So going to the town council, going to the county board and saying, you are municipal employers, so you are facing the same problems that we've been discussing in terms of providing health insurance to employees. Municipal budgets are shrinking. A lot of that is being eaten up by health insurance premiums. We need Medicare for All as our community, and we're going to demand that our elected officials do this. So now we don't just have activists. We have local government officials who are also going to Congress and saying, we need this now. And since the pandemic, let me just say, Knoxville, Tennessee passed a resolution in support of Medicare for All. South Bend, Indiana, Washtenaw County, Michigan. Like these are not, just the coasts and the liberal places. People are experiencing this all over the country. And so we really can push this narrative and push these elected officials to take notice right now. And it's happening. And I think we're on the cusp of really being able to go huge.
Okay, so Melinda, what do you tell people when you're trying to get them to get involved? What is the first thing you tell people when they should become Medicare for All activists?
Well, there's a great coalition that Social Security Works and Public Citizen and many others are a part of. It's called Medicare For All Resolutions.org. And you can go to that website. There's a map of the entire country, and it has more than 350 dots all over it where there are towns and communities and cities that are organizing. So you can either sign up your town if it's not on there, or join one, and we'll connect you with people. And then by building those local coalitions, we talk to local officials. We are building a movement to talk to members of Congress to get more and more of these co-sponsors on the bill, to push for hearings. And so, starting by going to MedicareForAllResolutions.org and be a part of this broad coalition.
How many co-sponsors are there now? The number grows.
We have 115 co-sponsors, and as I mentioned, that includes some new members who had never signed on before, and that was because of really strong local organizing. There's no other explanation for it, because they also receive a lot of money from the insurance companies. But I think that's where you tip, where it tips, right? What Alex was saying, that they're seeing the political wind shifting, and that's only going to continue with our organizing.
Yeah, I also can't stress enough in this last piece here, Melinda. Melinda created the resolutions campaign, I'm sure with partners at Public Citizen, but the beautifulness of that campaign, it's because what we talk about here is that solidarity is what people need to understand. The isolation of the current modern American system is perpetrated on us to keep us feeling powerless. But when we are together, we can feel our power. We can feel making things happen. And then we realize, in fact, all the power is in us. And all of these other tricks are to tell us we're powerless. Well, getting involved at your local level is about feeling that and getting in community with other people and seeing the change that you can enact, that you can make happen, the magic of organizing. So I really want people to go to Medicare for All Resolutions.org. Take part in this. Get involved in the fight at your local level. It all is part of this popular movement, and that's the only place we're going to win the fight to create a health care system in this country instead of a wealth extraction system. Melinda, thank you so much for joining us on Solidarity Live today.
Great to be here, and I'm glad I'm in the fight with all of you.
Thank you so much.
Bye. Yeah, the fight for Medicare for All. It is I get to work with Melinda all the time. We just had a big call yesterday. We're trying to get everybody to understand now is the moment to really demand more from And that, you know, yes, Biden ran on an anti-Medicare for all stance. You know, we were, Jocelyn, you and I in Iowa when Bernie Sanders was running on the pro-Medicare for all stance. But you don't give up. In fact, this is why we need to demand more. And the pandemic, the reality that people are facing, politicians say a lot of things, but they react to the reality that is in front of them.
So I love that you say that, Alex, because I think I also am guilty of thinking of political trends as being less mutable than they are. We tend to think of a candidate as being tied to their platform or whatever but like politicians change their minds all the time. It's why people don't really trust them, which is fine. I mean, but they should be changing their minds all the time. And you know, your friend and mine, Michael Phelan, we're reading this book. We're reading the filibuster book, Kill Switch. It's really good. But one of the parts that blew my mind about it is I didn't know that Lyndon Johnson was like very anti-civil rights. And then he became the boldest civil rights president we've had. Like, you know, it's people change. He responded to big organizing.
He might never have changed. Right? We don't know what is in his heart, but I doubt,
That's true.
I doubt his heart changed that much. He's an old man when he was an older man when he became president. But he's a politician. He actually reacts to the reality that's in front of him. And that is it's just so true. So what we have to do is change the reality. I sometimes say the landscape, and we shift it under their feet. And if I know you know this, but I actually don't know if you've ever done this, Jocelyn. I think you would enjoy it. Everyone, and Melissa Byrne, an amazing activist who's been on the show, is the one who she started this looking back at student debt, and she tweeted out, man, everyone should go watch C-SPAN from the 90s to see just how garbage the Democrats were in the 90s. And saying the 90s is really, really generous, right? Because in fact, something Melinda said, we're way past what was allowable during the Obama era, because we don't think of it as allowable anymore. We're trying to create a structure that forces the politicians to do what we say is allowable. So I really want to talk about the filibuster now that you brought it up, but it's all the same fight. We talk about this often, and you sort of opened the show on a very somber note of police continue to kill unarmed Black men and women and girls and boys in this country, and at such an obvious systemic level that we need to change this system.
And it's not totally disparate from the Medicare for All legislation, because the Racism in Public Health Act that Congresswoman Presley has been, I think she's the primary sponsor of it, being Black in America is a pre-existing condition, not just because of police violence, but because of medical negligence and medical abuse, because of the ways and places that Black communities are organized, because Black people are more likely to be exposed to environmental toxins because their communities are put in places that have more environmental toxins. It all goes together. It all amounts to state sanctioned murder. And it's this, I really don't recommend anyone watching any of the videos online right now. We just watched a 13-year-old boy get murdered by a cop. Again, this isn't new. It's not.
And the mayor lied. Oh, right. I won't ever Mayor Lightfoot went on and for 2 weeks alongside the prosecutors lied that he had a gun. And she saw the video that now is out there, and they fought the release of. And so you just this is a corrupt system. And I agree with you about the public health aspects. Structural racism and violence is a public health issue, a massive public health issue. Black and brown men and women face extraordinarily elevated risks of all sorts of harms. But I also want to bring it to this sort of like unimaginable change that we're talking about, right? Like, oh, well, the system, what are you going to do? Just build a whole nother system? Like, yes, that's what we've done multiple times. It's once the pressure is big enough and it becomes irresistible, it's super easy.
Well, because all of these are choices. I mean, I think this is another thing that Michael and I have been talking a lot about for some of the work we're doing with, sacrifice zones. This idea that you take the places in the country that are most polluted, and they're zoned by urban planners to be places where people of color are more likely to live. That is a choice. It's not like some magical enchanting, oh, I wonder why this group of people then have higher cancer rates. I wonder why they have, more respiratory disease, because you're putting them in polluted areas. That's a choice. We can unmake that choice just as easily. And of course, it's going to take investing, and it's going to take, but I don't even like the word investing, because that makes it sound like charity. It's not charity. It's creating a society where a government is not murdering its own citizens
at the behest of big business, who profit off of it. This is a sort of small but also huge example that I often come back to, because there's like a massive industry of apathy and throw up your hands in this country, because it benefits the bosses, big money. And it's sort of the like, well, what are you going to do about it? Right? Like, oh, these are unsolvable problems. And first of all, usually we have really good policy solutions and implementations. Like, what are we going to do about the dying earth? And you're like, stop giving extractive industry tax subsidies. Just start right there. Massive investments in renewable, right? Like, we know these things, but there's a big industry of this in DC. And I always tell, when I get hit with this on policy, I tell this story that's pretty amazing, maybe apocryphal, but about the, I don't think it is. I think it's real, about the creation of Social Security. There's a huge, Wall Street push against the creation of Social Security. And there was a senator who was against it. And he said to one of the new dealers, to Francis Perkins, one of the people who was creating it, what are you going to do? How are you going to know what people's wage history is? What are you going to do? Just write down all of their incomes on index cards and file them in file cabinets, one for every single person in this country, and then catalog it over the years? And the new dealer was like, that's a great idea. Yes, that's what we're going to do. Thank you. We didn't have a good idea. It's just like, when there's a problem, we can figure out a solution. Oftentimes we have really well-designed solutions already for things, including with police, with police violence. We know what we need to do in many cases. First of all, one of the biggest ones is little itty-bitty municipalities should not all have their own police forces, like around St. Louis. If you go around St. Louis, you drive through the collar communities, and like you'll drive through like 50 of them as you go around. And each one of them has a police force, and each of those police force are incentivized to extract money from people. And what that means is prey on poor people. And what that means is prey on Black and brown communities to extract revenue from them. Get rid of that system. Have larger areas covered so that there is more responsibility. We have the ability to actually have the federal government monitor what's going on and track this. Oh, what are you going to do? Are you going to track every single time a police officer pulls their gun in this country? Yes, that's a great idea. We should have one giant federal database. And then if we see that officer asshole who moves from place to place to place as he gets fired is a violent person who took this job so that they could perpetrate violence on people of color. We track that now, and we don't hire him and prosecute him for any crimes that he committed.
Well,
Like,
and
this is simple stuff.
the people who have the faith in the lone good cop really shock me. I mean, these are the same people who say we can't change the political system we have, and yet you're relying on the off chance that somebody who's filled with moral clarity is going to choose to be a police officer, a profession that largely involves like pulling people over for speeding. No, I mean, most of the people who become cops, you don't become a cop because you're filled with love and compassion. Maybe sometimes, I guess, stuff happens.
But whatever, that person's supposed to be a cop and change the entire structure, you know? Like, no,
that's a good
they're not going
point.
to be able to.
Let's say that 10% of policemen are Gandhi. Let's say that's true. How, like, logistically, how does that work? How do those 10% of, you know, we're going to call them the best people on the planet? That's not how systems and organizations work anywhere. If you have a majority of a system which is used to murdering with complete impunity, like that's a bad system. That system needs to be dismantled, defunded, done. Just like we're going to just start the whole thing over.
Well, what about qualified immunity? And we're now talking about police violence and structural change. The qualified immunity is like so civil forfeiture and qualified immunity are the two dumbest concepts that we've come up with in the criminal justice area. So civil forfeiture is just cops robbing people, right? Like, that's what it is. It just means, and the case isn't even against the person that they robbed. It's against the property that they took. And it's just cops going and taking people's cars. In Philly, this ProPublica investigation, Philly, they literally just lifted the cash out of people's pockets on the street and stole it from them. Like, that's a gangster situation. That's when the cops are the biggest gang on the block. Get rid of civil asset forfeiture.
I want to end on a personal note because I didn't even think to share this story until we're talking about it. So I think another thing we don't think about is like, what does it mean for a community where you don't feel safe calling the cops? Like, people are like, oh, who's going to protect us? There's no one protecting us now. You know why? Because people like me I'm not going to call the cops if I have a situation. Just the other week, I was walking around my neighborhood, which I live in Northwest DC, and a guy got really like violent with me and was very threatening. And like, it was kind of a scary situation. And guess what I didn't do? I'm not going to go home and call the cops in that situation because you don't know how it's going to escalate. You don't know what's going to happen. And then like me as a citizen who was just minding their business, now I'm like, okay, well, who do you call in those situations? When you can't count on the people that are allegedly here to protect us in violent situations without them, you know, reforming to street executions. I don't want to be the reason that somebody gets shot. That is there's so many chilling things about the Derek Chauvin trial, but you listen to the people who called the police and they're just, their lives they're traumatized. You know, they called the police on George Floyd for this minor interaction they had with him. And they're now on the witness stand, like devastated. You know, I keep going back to that day. I would do anything to not call the cops. Because they were just trying to be like, hey, I think this dude used a counterfeit bill. And like, they weren't trying to say he's violent, now murder him in like bare daylight. It's a terrifying situation. It's terrifying for everyone, even if you aren't the person who feels vulnerable to that kind of violence. It permeates everything. There's no way it doesn't.
And that's why what we're talking about, again, like the healthcare system and so many other things, these are structures. It's structural violence, structural racism. It's being perpetrated on the people. And so we can't actually deal with it in an individual level. Each person can't. And we're told, over and over again that this is the land of personal responsibility and it's all BS. This is structures set up to protect the ruling elite class, the plutocrats. So the only way we can actually change things is working together in solidarity, standing together and demanding big structural changes, because what we're facing is structural violence. And so it's only through pragmatic solidarity that we can win. And luckily, that's what we come on every week to remind people that it is possible. It is real. We might not win it all in one. You might not win the thing that you really want, but we need to always fight for big reforms. And if we ever think that it is an individual case and that justice could be served in one case if the verdict goes the right way, it's not about the verdict going the right way. I hope it does, because justice not being served at an individual level is a travesty. But this is about the system. We can't deal with this in individual instances. The system is empowering this violence, and it will never stop until we change the system. And so that is, I'm hearing I'm glitching too. So I'll end it there by saying we will be able to change the system when we work together in solidarity. Thanks everybody for listening to Solidarity Live.